In this video, I'm going to go over disc herniations from the L4 to S1 area in the lumbar spine. How can you decrease your pain and improve your mobility? When we're discussing the lumbar spine, we have 5 vertebrae and then we have the sacrum here. Now with the lumbar vertebrae, it is L1, 2, 3, 4, and then 5, and this is going to be S1. And you see where the nerve roots, these yellow pieces are coming off. Those are the nerves that are going out throughout the body. Now for my model here, I have a pink and green nerve. So the pink is going to represent the sciatic nerve that comes out, and the green represents the femoral nerve that comes down through the abdominal wall and then travels down into the femur and on down the leg. Now, a lot of times people have disc herniations and they think, well, the only option is surgery. Now, of course, sometimes surgery is the only option. There's also injections and nerve cauterizations that can be done. But there are a lot of cases that conservative therapy intervention can have a profound effect on reducing pain and improving overall mobility and function. So what is the disc? The disc is known as the intervertebral disc. That's the red piece that you see here. The disc is responsible for holding up approximately 50% of the weight of each vertebral body. The facet joints on the back side here, those are going to hold up 25% and 25%, which makes for 100%. And what can happen is the disc itself, the material inside is known as the nucleus pulposus, that can come out or push outside this wall, and that's going to cause this to protrude out or herniate, kind of flow out of that ring, that outer lining wall, and then that's going to get on the nerve root, and then you have pain that travels down the leg. Maybe it stays in the buttock area or just in the low back. And a lot of times people can have debilitating symptoms of this. It's very difficult in order to be able to stand up or sit down, maybe even sleep and rest. So there's going to be some different exercises that we're going to go over and a few stretches that work really well at reducing your symptoms and improving your overall functional outcome. Our first technique is going to be standing lumbar traction. What you're going to do is go behind a chair and you're going to lean over, pushing down through your arms. I'm keeping my feet flat on the floor. So a lot of times people go up on their toes with this. That's incorrect. Try to keep your feet flat on the floor. Lean over, kind of round your back over just a little bit, and you're going to feel that stretch in the lumbar spine. We're trying to kind of open up those nerve roots where the nerves come off, kind of stretch that entire area out. So just lean over and stretch that. Hold that somewhere between 10 to 15 seconds and repeat that for 3 to 5 repetitions just throughout the day. These are going to be cat-cows. Now, a lot of people do these in quadruped position, where they're on their hands and knees. I like to do these in a chair just because I think it's easier, especially if you're having a lot of back pain, a lot of radiating symptoms. Sometimes this just works best. So what you're going to do is just sit in a chair and you're going to work on the cat portion, kind of rounding your shoulders over, kind of hunching over. And then you're going to go back, poke your chest out, increase that curve in the low back, kind of look up towards the ceiling, and then go back down. And what this is doing is really just moving the disc a little bit and all the tissue in the area, the muscles, ligaments, fascia, all of that, just kind of getting that to move a little bit. If it's too painful to go all the way forwards in the cat position or all the way back in the cow position, just go as far as you can, basically just easing into it and progressively increasing your range of motion. You're going to repeat that for 2 to 3 sets of 10 to 15 repetitions. This is going to be the Sphinx position. So what you're going to do is prop on your forearms here, and you're going to keep your pelvis on the bed, floor, mat, whatever you have at home. You're going to work on kind of pushing up. You're going to hold that for 2 to 3 seconds and come back down. You may feel a pinch in the low back. That's normal. If it's too painful to go very far, just go a little bit, just stop and hold that, and then come back down. Work on trying to repeat that for 2 to 3 sets of 10 to 15 repetitions. Now stay in that same position that we were previously in with the Sphinx position. We're going to go into a prone press up. So you're going to go up and then look up towards the ceiling. Also similar to a cobra position in yoga. So we're going to go up, push up. Now with this, if that's too painful to go all the way in that in-range extension, just work on coming up, even if it's just this far, and then come back down, and then progressively work towards going into more extension. Repeat that for 2 to 3 sets, 10 to 15 repetitions. These are known as opposite arm, opposite leg. So what you're going to do is stay on your stomach. You're going to work on right arm and left leg, comes up, both into extension, left arm, right leg, and just alternate that. Initially, if that's too difficult or too painful, just work on the right arm going up and then left arm going up, and then do each leg individually. I usually have my patients do that for 2 to 3 sets of 10 repetitions. If you're going all at the same time, if you're not moving all those at the same time, you're just working on just one arm at the time or one leg at the time, then I usually have my patients repeat that for only 5 repetitions for each extremity. Next, we're going to work on a bridge, and so what you're going to do is you're going to want to flex the hips, flex the knees or bend the knees, kind of have your arms down beside you, and you're going to push up, bring in your pelvis off of the bed, floor, mat, whatever you have, and come back down. Initially, you can just start small, just go up a little bit, and then work on towards coming up even higher. You repeat that for 2 to 3 sets, 10 to 15 repetitions. These are going to be standing band extensions. So if you have a longer band that you can just fasten to the wall, wrap around your upper back, that's fine. But if not, you can use one of these bands that has the handles. What you're going to do is bring your elbows in by your side, keep your elbows bent, and then lean away, pulling on the band. Come forwards, lean back. You repeat that for 2 to 3 sets, 10 to 15 repetitions. And then you can turn around and you're going to go into a forward trunk flexion. So taking the same band here, elbows by the side and lean forwards and come back, forwards and come back. Complete that also for 2 to 3 sets of 10 to 15 repetitions. These are going to be resisted band rotations. So taking that same strap, you're going to keep your elbows tucked in nice and tight beside your side, and you're going to go to the left 2 to 3 sets of 10 to 15 repetitions, and then you would turn around and repeat this to the right for 2 to 3 sets, 10 to 15 repetitions. This is going to be a sciatic nerve mobilization. So what you're going to do is kick your knee out straight, pull your foot and toes back towards you, and then you're going to look up at the ceiling, and then you're going to reverse that. You're going to look back straight again. You're going to bend the knee, pull your foot back underneath you, and then point your toes down and back. So that is knee out straight, foot back towards you, look up at the ceiling, back to neutral with the head, knee bent, foot and toes pointing down. Repeat that for 2 to 3 sets of 10 to 15 repetitions. Our last technique is going to be a knee to chest stretch. What you're going to do is in the seated position, just pull your knee up as far as you can. Hold that for 10 to 20 seconds, and then repeat that on the other side. Pull that back and hold it for 10 to 20 seconds. And you want to repeat that stretch just throughout the day. People do ask whether they use heat or cold or even those home TENS units. All of that is fine as long as that's okay with your doctor, your primary healthcare provider. You're safe to use those. All those things can be an adjunct to help promote movement as far as long-term return to function. Because remember, we want to go through our movements, our loading strategies, those strengthening techniques. Those are the things that's going to improve our pain the best for the long term. Hope this video helps to decrease your back pain and improve your return to function. Make sure you hit that subscribe button so you can stay up to date on all my content. Thanks so much.